What's up, everybody? This is John Pena-Serrata at the Move Better channel. We're here today to show you guys some foam rolling techniques to help reduce any kind of risk of injury or sports injury while you're out there playing. I have with me today Matt Chen, chiropractic assistant and personal trainer here at Shift Movement. And so we're gonna go ahead and show you guys these tips, and here we go. So one of the first exercises that we use to help reduce any kind of lower back pain or any kind of injury is a foam rolling technique and exercise for the thoracic region. So basically your back, anywhere from the mid to upper back, which also can affect the lower back region. We have Matt here. Matt?
For the first exercise, I am going to position the foam roller right behind me, sitting in front. And then I'm going to set that guy right on the base of the rib cage here. From this position, hands behind the head to support the neck. Pull the elbows in to get those shoulder blades out the way. And we're just going to lift the hip and just go up and down the shoulders here, looking for tender spots. And we're just going to hold and take deep breaths in and out.
So how far do you want to go? From mid back to back of the neck, or
Absolutely.
how far?
Yeah, so we're going to go from that rib cage here, mid back region, all the way up to those traps and shoulders. Again, really looking for just tender spots. We don't want to spend too much time here, maybe 20, 30 seconds, just taking deep breaths in and out.
Just getting the blood flow in there, right?
Absolutely.
That's actually really important when you said taking deep breaths, because remember, breathing also helps release the tension of your connective tissue. So you want to make sure you're always breathing through your belly, through the nose, inflate the belly as you're doing the foam rolling technique right here.
For sure.
Cool, how's that feeling?
It's good, yeah. Finding tender spots, especially if it's really tender and, there's a lot of pain there. You just want to make sure that you're constantly breathing through it. Don't seize up and just hold your breath. That's not going to do much for you there.
All right, so in addition to doing the foam rolling up and down your connective tissue in your thoracic region, one of the other things that you also want to add to this is to mobilize the spine with flexion and extension. So go ahead, Matt, and show them how to do that.
Absolutely. So from here, instead of raising up the hips this time, I'm going to have my hips planted on the floor. Remember, we want to keep that core engaged at all times. Hand behind the head to support. And then all we're going to do is exhale and lean back as far as we can. We don't want to push it too much where there's pain. Just get a nice stretch going, take a few deep breaths. We're going to do a little crunch, scoot down so we're moving up one section of the spine, and we're going to repeat all the way up that spine there.
So if you can see from the side view, right, he starts off with a little bit of a curve in the upper back region, and then as he extends back, it's almost like you're trying to straighten out the back, the upper back, and even bending it opposite of what you started with. Okay, and a lot of times when we are doing some of these sports with our posture, we have a limited motion in the middle and upper part of our spine. So what this will do is help mobilize that area, okay, and get some blood flow in there and hopefully get the tissues to move a little better for you, okay? For those of you that experience limited range of motion with shoulder flexion, one of the reasons that can potentially be happening is because we have some really tight latissimus dorsi muscles, okay? So when I say limited shoulder flexion, he's not able to go maybe farther than here, or even sometimes we may just experience it where the arm and the shoulder only gets up to that point. What we want is we want to be able to come up even aligned to your head for the most part, sometimes even post that. And a lot of times, again, what's limiting that range of motion, if we look here, are the lats. It's a big muscle group right here that's connected to the arm, goes all the way down to the spine and even the lower back area.
So one compensation for limited shoulder flexion would be reaching up and then arching the back. Yeah, this shoulder is now next to my ear, but you notice how I have a very arched back here. Usually means there's some tight lat muscles there. Another one would be leaning forward like this or just dropping the arms like this. This is as far as I can go.
Right, and some of the worst case scenarios, when you have that limitation and you create these compensation patterns, you may even create like impingement in the shoulder, which can affect some of the nerves in that region. And next thing you know, you're having constant pain. So pay attention to that. Pay attention to the mobility of your shoulder and try this exercise and see if that helps out.
For the lats here, we are going to, again, position the foam roller down on the floor. I'm going to be in a side lying position just like so. Again, positioning that foam roller right at the base of the rib. Extending my arm out like this and having my lower body position like this. I like to do this by lifting up my hips by pushing off my knee. And then from here, again, we're just going to roll up to the armpit and down. Usually this is a little bit of a tender spot, so kind of just do that accordingly. You can drop the hip down, find that tender spot, hold it, take deep breaths. If you want to get a little bit more, you can always just raise that arm overhead as well.
Yes.
And then find another spot. Do that same motion. You can even add a little bit of a rotation with those arms there. Back and forth, flipping that palm over this way and reaching overhead. And those would be good ones for the lats there.
So you notice when he raises his arm up, what that does is it actually elongates the connective tissue of the lats, and that can help release some of that tension in that area as well. All right, some of the more common injuries that people are feeling are the lower back and maybe even the knee, right? That's common, right?
Yes, sir.
So what we like to look at is, if you look at it from an anatomical perspective, what connective tissues are actually affecting the lower back and the knee, okay? And from what we do, we know that the hips is a very important and integral part in making sure that we prevent any kind of injury with the knee and the lower back. So what we'll show you here today is how to foam roll and do some exercises with the foam roller in the hip area. So Matt?
Taking a seat on the foam roller just like so. I'm going to be working on my left glute here. I'm going to bring my left leg over my right, kind of creating this number 4 pattern here. Shifting my weight over to the left glute. All I'm going to do is just go up and down that muscle. We're just going to find tender spots. So once I find it, I'm just going to hold, take deep breaths just because it's going to be a little bit tender. And then if I feel like this is pretty easy, then I can add a little bit of internal rotation here, pulling that knee in towards my belly button, or even pushing down and getting a little bit more of a stretch on that glute muscle there.
Excellent. So remember, the glute, if you look at it from an anatomical perspective, it's connected to the IT band, which wraps around the kneecap. So why do we want to foam roll the hip and release some of that tension? It's because if the hip is really tight and limited in mobility, it creates tension on the IT band, which can affect the knee area, right?
Absolutely.
So the other thing is, why does he have his leg at a figure 4 position? That helps create a more of a stretch position for the glute area and the piriformis, and that will help target that area even further as he does foam rolling the glute area. So another part of the hip area that you may want to apply foam rolling for is what we call the TFL, or the tensor fasciae lata, okay? Again, that's a pretty nice muscle right here that's connected to the IT band, and it can affect the lower back and the knees based off of like how tense it is and depending on how mobile you are. So Matt, go ahead and show them how to do foam rolling for that muscle right there.
So as you can see here, I'm kind of placing that foam roller on the pocket area of my side here. I'm just going to make small micro movements up and down, making sure that we're not getting on that bony part of the hip. Once I find a tender spot, what we're also going to do is we're just going to drive that top hip forward just a little bit, or bring it back just a little bit to find another tender spot. We're just going to go up and down just like so.
It's important that, well, what's important and also interesting about that muscle is it goes across right here. So a lot of times people aren't aware of that muscle tissue. So again, for all the athletes that we're working with, make sure that we do give that some attention, especially if you're feeling tension in the lower back, hip, and knee, okay? Most of us may experience some really tight hamstrings, especially athletes, runners, basketball players, CrossFitters. So today we're gonna show you guys how to use a foam roller to help relieve some of that tension, to help prevent that injury and make you or allow you to perform a lot better out in the field or whatever sport you're using.
Rolling out the hamstring, again, we have an outer part and an inner part. For that, I'm going to place the foam roller down, sit right behind it, and place that foam roller right above the back of the knee here. So again, we are finding those tender spots on the inner part of the hamstring. I have my foot turned inwards like this, supporting myself on my right hand. We're going to look for tender spots, hold it, take deep breaths. If I want to get more of the outer hamstring, I'm just going to shift my weight to the left, turn that toe out, and then get more of that outer part of that hamstring.
What's important to know is that there are 3 parts of the hamstring, so that's why he is giving all 3 heads or all 3 parts enough stimulation to help relieve some of that tension. Okay. The other thing that he's also doing, aside from rotating the leg internally and externally, is he could actually fully extend the knee a little bit further and that will actually create a more of a stretch for the hamstring. And as he foam rolls it, hopefully that will help relieve some more of that tension. So in addition to preventing that injury with the knee and even in the lower back area, foam rolling the quadricep, which is 4 muscles in the front part of your thigh, is very important as well, okay? So I'm gonna have Matt here demonstrate how to do that right now.
All right, so for the quads, again, 4 muscles. We're gonna get into a plank position. I'm gonna have that foam roller right above my knee. With my right leg, I'm gonna get into a 90-degree position, and we're just gonna go all the way up to the hip, getting the middle part of that quad. We can also get the outer part, number 2, which is the vastus lateralis. So I'm shifting my weight over a little bit more outer of that quad. We can get the vastus medialis, which is the 3rd inner part of the muscle here. And then for the 4th one, which is the adductors, it's going to be a little bit of a change. We're going to get that foam roller so it's right next to us like this. I'm going to position myself in a plank, 90 degrees on this leg, and we are just going to go in and out. You will feel more tenderness towards the outer part and inner part of the leg there. So really just apply as much pressure as you can handle right there. You can extend the leg out, back, go up or down as well.
So he added a few extras there for you. He added the adductors a little bit more, which is connected with the quadricep as far as synergist muscles. And then it's also important to see that he did a little bit of extension and flexion and internal hip rotation and external hip rotation. And what that does is it helps mobilize those tissues even further while applying the pressure from the foam roller to help get blood flow in there and hopefully release a lot of that tension. So in addition to the foam rolling exercises we just showed you today, why don't you guys check out Dr. Joe's video with the massage gun that helps prevent injury for the knee, as well as a video on how to prevent and address any kind of lower back issues. And if you like the information that we're giving you and you really enjoy all the exercises and the tips, please give us a subscribe. Thanks again for joining us here at the Move Better channel. We'll see you again soon.